for me, I guess, a virginal experience, which at my age, it's fun to have those kinds of things. So this is wonderful. And I first would like to introduce you, Amgad Hakim, because we've had a wonderful 17 years together. And as I started to think about how long we've been together, it almost seems unreal because it seems like not too long ago, but 17 years is a good long time.
Time flies. Time flies when it's a good, integration between a pharmacy and a clinic. You won't feel the time, and that's how we feel it and how you feel it as well.
Exactly. And you certainly are the premier service that we have here in Burlington and Aldershot. And I think the reason is that you and Wellbeings really care about the people we serve.
Absolutely, absolutely. Our main focus and the primary goal is the patient care, and we try, to improve always the services that we provide to our patients in Aldershot area through either well-being or through other pharmacies in the area as well, which is Aldershot Guardian and Aldershot Remedy are two among many maybe in the area.
Yes, but they stand out in the area, I have to say, because
Thank you.
I know sometimes when we might have had a difficulty with someone fulfilling their prescription for whatever reason, it might have been they've been sick, so then they didn't get it done in time or something, and then they show up and maybe you're closed and we've made a phone call. Your pharmacists have really stepped up to the plate where others might never have responded to make sure that the patient receives the information and the medications that they need. So, as a provider here from Wellbeings, I want to say we truly appreciate the extra efforts that your team gives to all the patients that we have.
Thank you. Thank you. I appreciate it.
You're welcome. I would like to talk a little bit first about how you came to be a pharmacist and what brought you to Canada. I know your story and it's amazing. And then I'll continue on with some other things. So if you could kindly give us some background information, I think you have a wonderful story.
Thank you. Thank you. I graduated from Cairo University in Egypt, as so many other pharmacists in Ontario. I don't think this would be a surprise to anyone who lives in Ontario because at one point of your life, you probably bumped into one of the pharmacists, as we are so many. It was a great opportunity, for immigration or moving to Canada back in 2002, which is right now, I would say 22, 23 years, um, where you have to go through the process as an international grad to evaluate your degree, and then you go through the same exams and licensing in Ontario as any other graduate here in Canada. And then I started my own business in 2007, running an independent pharmacy, which I always value, having an independent pharmacy. And since 2007, we've been serving as a pharmacist either in Oakville or Burlington area.
Wonderful. And I know you have many different pharmacies as well, quite a number of them actually. And so I think that also speaks to the fact that you do such a great job that people want to come and you've expanded your system.
We're a big team. I don't want to speak about myself, to be honest with you. Like it's a big team, and sometimes we help each other establishing a pharmacy either in Oakville, in Hamilton, in Burlington. So it's not really this whole part or this whole is just myself. It's a big team of pharmacists, and each operating pharmacy manager or partner is the one who should take the credit, to be honest with you. Maybe I am supportive to start up or to establish a pharmacy and to try to provide the same quality and the same services that we provide anywhere in Ontario. But our main focus and goal, as you mentioned earlier, is Burlington and Oakville.
Yes. And just as a quick aside, because I know so much about your wonderful group of people, you also do a lot more in the community than just provide medications that doctors write prescriptions for. And some of that, if you can kindly tell us about how you also provide meals for people, because for people that are right now unable to have regular meals because maybe they're unemployed or they're homeless, you and your team provide a service that I don't know of any other group that does the same kind of thing in the pharmacy industry. And I could be wrong, but I know you provide something exceptional.
I'll be honest with you, this is not related to the pharmacy business at all. It
Ah,
just happened that nothing at all. It's not related to the pharmacy, but it just happened that you know about it because we just have an interaction with mutual patients that require to be like registered with a group that provide hot meals or like food banks in Mississauga, in Oakville. But it's, I'll be honest with you, it's not related to what the pharmacy do, but as a volunteer side, yes, our group are involved in some of the like there is a group called CIU Community in Unity in Oakville. We serve as well under the umbrella of the Frontline. That's in Oakville as well, that provide for people who are like either in need or like homeless in in Hamilton and downtown Toronto as well. So it's just we try to support as much as we can, but it's not related to the pharmacy,
ah.
not to mix. But it just happened that one mutual client that you referred to before, and we said, let me try to link him with other group, which a volunteer basis on weekends or, but it's not a pharmacy related.
Well, isn't that wonderful? It speaks to the kindness and the desire of people that are related to your pharmacy, perhaps, as to where they give in their community. So, kudos to you and your teams, even if it's not pharmacy related, because it's so needed right now during these special times.
Absolutely, because it's part of the, like, I would believe that any healthcare professional, whether a pharmacist or a doctor or a dentist, if they can support their patients um, by directing them for areas that can help them in other sectors, not to provide it, because being a pharmacist in Ontario, I have to abide and to follow the rules of the Ontario College of Pharmacists and what I can provide and what's the scope of my practice. But it is the same as if someone can step into your pharmacy and ask, oh, do you know where's the nearest hospital? So you have to direct them to the nearest hospital. If someone
Mhm.
step to the pharmacy and asking, do you know where's the nearest food bank? Because there is a family moved into our area and they need some support. So you provide them, okay, let me look it up. Can you
Mhm.
call a taxi driver for me or a cab for me? So that's what, like, it's a kind of a social moral support rather than being like an official support. But and I would assume that any pharmacist or a doctor or a dentist or any healthcare professional that has an information that can help his patients or people around in the area, he would not hesitate uh, to provide the connections.
Yes, I hope so. I do. Going back to look at some of the roles that pharmacists have played in keeping people healthy, what can you tell us about how you help to keep people healthy?
See, a pharmacist's role in Ontario, as most of the people in Ontario really know and appreciate the role. And let me tell you here that the pharmacist in Ontario is number one trusted healthcare professional in so many surveys that has been done in previous years. So it's not only myself, I'm just one example of so many better ones, like to be
Mhm.
honest. Not trying to be humble or something, but it is a fact. Every single pharmacist in Ontario is willing to do an extra mile to provide, like, better service and to improve the healthcare because we are part of it, and we believe that people and the government put a lot of trust in us, especially during COVID. And this is what I will go through right now. Back to your question, how do we have a role, or how do we keep patient health our priority, or how can we improve? It's not only about reading a prescription, dispensing a prescription, but it's the picture is way bigger than that.
Mhm.
Um, is building a health relationship between a pharmacist and a patient is a very important role for any pharmacist in Ontario. The pharmacists keep the records of the patient. The pharmacists keep the allergy records of the patient. The pharmacists check if any contradiction for any prescription that can contradict with an existing health condition or an existing um, like medication list that the patient is on for quite some times. We also encourage people not only prescription medication, we also encourage people to check with the pharmacist for the simple stuff that they feel that it could be simple, which is like grabbing a bottle of vitamin, a bottle of Tylenol, Advil. Please go and talk to your pharmacist, check with them.
Mhm.
Um, don't take things simple because our job and our role as a pharmacist is to check and to make sure that you are getting the maximum benefit of the medication. We also want to make sure that you are not over medicating yourself. I've
Yes.
seen people that are healthy and really good, but they just want to take pills. Like, I want to take vitamin, I want to take, you know what? Hold on, talk to your pharmacist. The pharmacist is able to give
Mhm.
you like a better perspective of what you need and what you don't need. Of course, the pharmacist does not work by himself. The pharmacist works under like a close interaction and support with other healthcare provider, whether doctors, dentists, specialists.
Mhm.
Um, of course, the pharmacist as well, because of the trust of the government and the support that we give or we get from the government. Now we are entrusted as well for giving a lot of vaccination, like the COVID vaccine,
Mhm.
like the flu shots.
Yes. And early, I think it was January 1st, 2023, the pharmacists actually got new powers. And I might suggest that's because we do have a doctor shortage. But I think much more importantly, it's because they recognized that the pharmacist has had a great ability to be able to free up some of that space by looking at some of the minor ailments. Can you tell me some of the things now that you're able to do that have been given to you because of the trust factor?
Absolutely, you nailed it. Like, you probably read more than what I was gonna say. Yes, it's at the beginning of 2023. It's not power. It's actually, it's again, it's a continuation of the trust in the pharmacist knowledge and give to the patient and the care to the patient is that there are some minor ailments, and in the patient language, it's not minor ailments. It's some like symptoms that people face or disease or conditions. You can call it so many things. And they are right now like 19 that a pharmacist can prescribe or can
Wow.
initiate prescription. And there are 14 or 15 coming soon, January 2026. And the scope is getting bigger. And an example of that, which I want to say it in the patient language, some skin problems, some eye problems, without going into details, some urinary tract infection, some
Mhm.
muscular pain, and the list is bigger and it's getting bigger and bigger. It's very hard to name every single one, but I would always suggest that if you go to a walk-in clinic and you can't find a solution or you can't get a hold of your doctor or the wait time is long, you may check with your pharmacist, and your pharmacist will be very honest enough to tell you that I can do something for you, or I can prescribe something for you, or your case has to be transferred back, or to a doctor, or to you
Mhm.
have to see your doctor, you have to go back to the walk-in clinic.
Mhm. And
Um,
that's great advice because sometimes the issues could be solved quite quickly and in a timely fashion. And certainly you don't want to be showing up in emergency if you have an ingrown toenail.
yeah, absolutely. And,
Like
and
that
it's
just costs everybody way too much money. So, and some people don't even have family doctors. So that's really good advice to make sure that you check with your pharmacist. You do a lot more than minor
Well,
ailments.
see,
You
everyone deserve a better and a fast care. So I would say even out of GTA, we hear from our friends who work up north or like, you know, in some rural areas, that there is real shortage of doctors. Uh,
Hmm.
like I would say Burlington, Oakville, Mississauga, we're lucky. I don't have enough statistics about the number of doctors, but I'm sure we are in a way better situation than up north. So maybe people for simple stuff, they have no other option except going to emergency room or going to the hospital.
Hmm.
And this actually affects those who are in a true need for the hospital or for
Yes.
emergency. And it also, like, you know, it does not help with the whole health system for like minor things. That's why we call it minor ailments.
Hmm.
And for some simple stuff, people up north, they cannot get a prescription, so their only way is, oh, you know what, I have an ear infection or eye infection, and it's a simple thing that could be pink eye, and they just run to the hospital because they need a prescription, they need to be treated.
Hmm.
I think this helped a lot, saving wait time at
Hmm.
emergency, giving people who are in need the priority that they deserve. And again, it is a continuation for the trust that the Ministry of Health and the government trust into the Ontario
Yes, so
pharmacists and
really
all the
good
Canadian
advice.
pharmacists. Yeah.
Check with your pharmacist or your family doctor first. But for some of the easier, perhaps solvable ones, just go in and see your pharmacist because they're
Yes.
happy to see you every single day at any time.
Yes, and still the pharmacist is trusted to redirect them to a healthcare
Yes,
professional or redirect the patient, refer the patient back to
yes,
the doctor according to his scope of practice.
yes. Um, You mentioned already that pharmacists are allowed to give vaccines and flu shots, and I think that's a wonderful addition. It's even more than that because they, for instance, if they're trained, they can do Sublocade as well. And there's a whole lot of things that really are wonderful. And I thank you for taking extra training that's required, sometimes even just to prescribe a certain medication. So, and I know you've stepped up to the plate before, and many other pharmacists have too. So, thanks for that. How can pharmacists help people to stop smoking?
I think smoking cessation is one of the like, you know, the areas that a pharmacist stepped ahead and helped with the community, and they have like there's different programs, there's different ways, and a pharmacist can identify while sitting with the patient whether they can help them directly or they can refer them to a doctor. But
Hmm.
again, and sometimes they need counseling as well, and there are so many areas. But I would say a pharmacist could be like, you know, an easy accessible tool or healthcare professional than that a person can sit down with to discuss smoking cessation. Also, because as you know, the pharmacist is allowed or recommended as well to do something called med check or medication review.
Yes.
When someone is using 3 or 4 more medications, maintenance drug or regular medications. So when the pharmacists sit down with their patients, they are able to unwrap some of the hidden questions or the questions that are not usually asked.
Hmm.
Like, for example, the lifestyle and the social activities. One of them is alcohol intake, smoking. Do you smoke? So when the pharmacists recognize the, like, you know, other risk factors, they can start encouraging the patients going through that route of the smoking cessation, and they can help choosing the right choice for them or to direct them to a doctor as well if needed.
Absolutely. And as you well know, we've worked in tandem together before because some of the treatments that we offer are for addiction or for reduction of dependency on certain medications. And so you probably are a frontline person in seeing all of that. And
Mhm.
I can just reiterate that you're really our trusted partner in everybody's recovery. And I want to thank you very much, Amgad, for that. And
Thank
I want to ask you if there's anything else you'd like people to know before we sign off. And I thank you.
I just want to say that we're always like ready to help. Speak to your pharmacist whenever you have question or doubt about your medication. Speak to your pharmacist when you see any thing that looks different from your regular medication. We always advise people and patients that you play a very important role in preventing um, dispensing error or preventing people receiving the wrong prescribed medication. So I always recommend, if there are any changes or in the discussion that happen between you and your specialist or your doctor, please ask your doctor to write it down on a prescription so you can hand it to the pharmacy. Do not accept a verbal advice for a change of medication unless you have it written, because this support your communication with the pharmacist, and as well to have it documented in case of emergency and you have to go to hospital. At least they have someone accessible like your pharmacist to ask and to check your like history or patient profile. Also, we ask people, if you feel any doubt or any unwanted side effect or a weird feeling that you get after receiving a new prescription, do not hesitate to pick up the phone and call your pharmacist. Do not hesitate to go and visit your pharmacist and talk to them and explain your concerns, and do not leave until your concerns are resolved.
Yes, patient safety first.
Absolutely, absolutely.
Exactly. Well, Amgad, I want to thank you so very much for joining us today on the Wellbeings Medical Show. And I will ask you again to let people know where your pharmacies are located in Aldershot, Burlington. And I thank you.
Thank you. Thank you very much. And we are ready to help and serve anybody in Aldershot, our patients and our community, in either Aldershot Guardian, Aldershot Remedy RX, or West Plains Pharmacy. We have 3 locations that covers all Aldershot area.
Thank you so very much for joining us today, and I wish you a blessed day.
Thank you very much. Have a
Thank
wonderful
you.
day. Thanks.
Bye.
Bye.